Good afternoon, everyone. I also want to record this session, but I have to, just a minute, please. It's here, I guess. The recording button here, okay. So Hammer said that people get ill due to a destructive mental program appearing following an emotional shock. Do you have at least one person in your environment who is diagnosed with a chronic or degenerative disease? We all know the answer for this. Let me introduce myself. I have almost 15 years of biofeedback therapy done, holistic therapies for more than 7,000 subjects. 90% of the subjects had at least one emotional shock, and 14,400 biofeedback therapies sessions that I have done with the SKIO device. Dear all, even if you are doctors, therapists, parents, or lecturers, we all here follow a single target to promote health. Visual evidence and long-term benefits of efficacy of holistic therapies, psoriasis and vitiligo. I confronted two problems along my working. When and how? Where is the emotion, how it gets to a disease? And also the distance from the emotion to the disease. Is it really the time when we diagnose as a medical doctor's patient? Is that time when we got ill, or is there something behind this, months, years before? As objectives, holistic therapies applied in a psoriasis case and also in a vitiligo case have shown positive results in improving the general state of health, skin condition, and are visually evident in the testimonial pictures. Psoriasis is a chronic autoimmune skin condition characterized by the rapid overproduction of skin cells. Q5 that I used is a therapeutic frequency generating device, an innovative concept, and the final result is a personalized, unique algorithm. We applied the device, local, external, on the skin of the patient. The next case is we treated with a therapeutic anti-stress protocol that has shown significant benefits. It addresses the psycho-emotional aspects that can accompany the disease. Let's start with the first case, psoriasis. We all know it's a chronic autoimmune skin condition that is characterized by rapid overproduction of skin cells. This leads to formation of red and scaly patches on the surface of the skin. The exact cause of it is not clear, but the literature suggests that it involves a combination of genetic and environmental factors. Psoriasis can cause discomfort and itching and may also have interconnected links with other systemic diseases. Classic treatment options aim to manage symptoms and reduce inflammation to improve patients' quality of life. We can see in the pictures on the left how initially the skin of the person was red with inflammation, also in the pictures on the left, at the neck, on the face, and on the right, we can see the hands with the lesions. So as clinical signs, we had red patches, silvery scales, dried and cracked skin, thickened nails, itching and burning sensation, joint pain and swelling, nail abnormalities, scalp psoriasis, plaques, and lesions may have clear borders and can be symmetrical, affecting both sides of the body equally. So the patient had almost all these symptoms. This is the device I have used in this case. This is a device that generates therapeutic frequencies, an innovative concept made from imprinted frequencies in it, the final result being a special and unique algorithm modified according to the pathologies of the patient. For instance, research highlights the effect that every living cell has its own frequency. This is good when the cell is within normal parameters. For instance, it's healthy. And when a cell is sick, the frequency must be reversed, as in the case of this psoriasis. These are the pictures after in May. And they show the result that I got on the neck, on the face, and also the hairy part. The hair has grown. It's not so white, and we have more dense hair. So we have here the pictures before and after, so on the left and on the right. The second case I want to refer to is vitiligo case. The result obtained, including physical outcomes, clinical appearance, and psycho-emotional levels, the effectiveness of the innovative copyrighted protocol that I have used. It will be shown. Its non-invasive nature combined with the optimized clinical parameters enhances skin appearance and mental equilibrium as confirmed by the results. The therapeutic anti-stress protocol has shown significant benefits in the treatment of this case. Beyond this impact on physical manifestations of condition, it also addresses the psycho-emotional aspects that can accompany the disease. By promoting psycho-emotional balance, this protocol helps individuals cope with the psychological impact of vitiligo. It addresses the underlying traumas stored in the subconscious mind, aiding in their release and healing. Furthermore, the therapeutic anti-stress protocol focuses on chakra balances, which play a vital role in overall well-being. Through this process, the energy centers of the body are harmonized, resulting in improved physical and mental health. The protocol also includes aura correction, which helps restore the energetic field surrounding our body by addressing imbalances and blockages within the aura. The therapy promotes healing on multiple levels in this way. By targeting the imbalances caused by stress factors, this protocol aids in restoring the body's equilibrium. It addresses the impact of external stressors and supports the body's abilities to withstand and recover from them. The use of this innovative protocol has shown remarkable clinical and psycho-emotional improvements. It offers a non-invasive approach to treating vitiligo, enhancing both physical appearance and mental well-being. With the support of copyright protection, this protocol stands as a testament to its effectiveness and results. We'll see the images. We'll have on the left the image that was before for this child. In the middle, we'll have an intermediate stage, and on the right, we'll see the results that we obtained after a couple of months of therapy. So here are the pictures before. On the left, we can clearly see the pigmentation of the skin, at the eyes, near around the mouth, an intermediate stage in the middle, and the results after a couple of months on the right side of the screen. What I have worked on are the emotions, traumas, chakras, aura, in all neurobiofeedback. I will give you some examples of the stages I have reached in this therapy. On the left side of the screen, I have the graphic of the emotions. We can easily see where I have placed the arrows that there is an unbalanced stage of the emotions. In a normal balanced stage, we have these emotions that they should connect to horizontal and parallel lines, as I have marked with the red. It's only a half of the graphic on the top in the beginning. Then we have some intermediate stages on the right, where we have those arrows. The emotions are blocked, and we have to balance them, correct them to be between those horizontal parallel lines. Then on the right side down, we have completed this stage in the down part of the graphic. And on the left, we have the result that we got with this balance of the emotions. We have only two that are out of the graphic. Then I have worked on traumas with biofeedback therapy. So on the left part of your screen, we have an image before. We have two skin components, so how emotions and traumas affect our organs, in this case, skin. This appeared 2 times in the beginning. Then we have intermediate stages, where on the right, where we still have the skin, and then this disappeared. In the end, on the left side of your screen, we have the after picture, where we don't have traumas in subconscious mind, and we do not have the impact on the skin visible. The chakra correction is very important. In a balance phase, we should have all the chakras in the middle of our, on the middle line of our body. We can see in the beginning that we had little chakras, and they are not on the same line. On the left down, the same thing happens. The head, throat, and the heart chakra. And on the right, we have a balance. We have balanced chakras. They are in the middle of the picture. I have also corrected aura. We have some pictures here. In the beginning, she didn't have any aura. We only had those spots, the red ones at the feet, the black one. Then we had the red up, and then we have up or down. Then we started to have the aura, but with the red spots up, or velvet spots up or down. And in the middle of the image and on the right of it, we have a complete aura, and a very nice one. And this protects us, is like a shield from energies that come to us, negative energies, I mean. Another fact that I want to show you is the fact that in the beginning, vitiligo had as 95%, and afterwards it went down to 69, to 52, to 42, and to 38%. as we went with the therapy. So as a result, in the first case, the Q5 device was utilized as a local external therapy. The device was daily applied, comparing the before and after pictures taken in April and May 2023, respectively. A noticeable difference can be observed. And in a second case, the therapeutic anti-stress protocol proved significant benefits. The therapy not only focuses on physical outcomes, but also addresses psycho-emotional aspects associated with the condition. Chakra balancing, aura correction, harmonizing the body's energy centers. As conclusions, both cases experienced positive and long-lasting effects, half a year in the first case, and almost 3 years for the second case. The benefits continue to be visible today, indicating ongoing recovery and also improvement. Dear all, for those of you whom are interested in growing together, supporting courage prophylaxis, healthy, non-invasive, and non-toxic ways of optimizing the state of health, I invite you to grow a community, maybe, because I'm new here, and thank you very much for that, where we can share our knowledge and expertise for the benefit of our patients. Thank you very much for your attention.